This podcast is produced by Outcomes Rocket, your healthcare exclusive digital marketing agency. Outcomes Rocket exists to help healthcare organizations like yours to maximize their impact and accelerate growth. Visit outcomesrocket.com or text us at 312-224-9945.
Welcome to the Chalk Talk Gym podcast, where we explore insights into healthcare that help uncover new opportunities for growth and success. I'm your host, Jim Jordan. Today's guest is Andy D. He's the Chief Marketing Officer of Lightbeam Health Solutions and a recognized thought leader at the intersection of AI, analytics, and healthcare. With executive roles at companies like SAP, GE Healthcare, Tableau, Andy has shaped strategy across pharma, medtech, diagnostics, and provider networks. He's been an early voice in the personalized medicine, population health, and practical application of AI from predictive analytics to autonomous agent workflows. His insights are trusted globally with readers in over 40 countries and featured across leading healthcare publications. In this episode, we explore the evolution of personalized care, the role of AI in shaping value-based health systems, and the human side of transformation. So Andy, tell me and the audience a little bit more about yourself.
Hey, Jim, it's a real honor to be here and speaking to you today. I'm Andy Day. I'm the Chief Marketing Officer of Lightbeam Health Solutions, headquartered in Irving, Texas, one of the pioneers and leaders in population health management, relevant in a value-based care context. Organizations like SAP and GE Healthcare, which is where I learned everything, had the unique experience of working across all four segments of healthcare: pharma, med devices, and diagnostics, payer and providers. Large companies like SAP and GE Healthcare. I've worked as a GM to build out healthcare and life sciences business of extremely fast growth analytics companies like Tableau and Alteryx that hopefully your audience has heard of, and recently became Chief Marketing Officer of companies like Media Analytics and privately owned Beam Health Solutions. So it's been a pretty varied and diverse career, if you will, and with a span of responsibility going across product management, full stack marketing, product strategy, business development, and all of that. And I've also worked very hard to earn recognition as an industry thought leader in the AI and analytics arena for healthcare and life sciences, and enjoy readership across 47 countries. I write a blog and extensively on LinkedIn.
So did you evolve to that out of your focus on data analytics? Is that a natural evolution of?
Yes, it actually starts. It's a very interesting story now that you ask. So while I was leading strategy and marketing for SAP, I was very intrigued by what used to be called personalized medicine. The first and most prestigious conference was held at the Harvard Medical School, the Personalized Medicine Conference. I attended, funded by my employer, which was SAP, and took copious notes and turned that into my first blog post. And I sent that to the founder of the Personalized Medicine Conference, Dr. Raju Kucherlapati, who founded that conference. And he wrote back and said, this is far better than the paid writers we employ to write the overview and the summary of the conference. So do you want to do that officially the next time? We'll pay for you to fly you down here and do the honors. And I said, oh my God. So this passion really found a voice. And that was the beginning of my blog. And it was an external blog. And then eventually felt, hey, LinkedIn has such robust blogging capabilities. I should really move the blog onto LinkedIn. And so the health science strategy blog was born. I've had the opportunity to be featured in just about every healthcare publication, do multiple podcasts, write byline articles and blog posts. So here I am.
So since you've been there since the beginning, I'd love to share your perspective on my thought. When this started, the word personalized medicine really gave us a vision of medicine for me, medicine for you. And
Exactly.
we realized that what we were really getting down to is stratification. And it strikes me 15 to 20 years later, now that we're at this AI point, that we could actually get back to that concept.
Exactly. I think the evolution's been interesting, right? Personalized medicine really started with big pharma companies talking about, hey, we can actually create medicine for a patient of one. And I liken it to the way Amazon recognizes my procurement habits as a consumer and presents me choices of what I'd like to buy, given the fact that we are all genomically and genetically different. Over the years, and of course, President Obama is credited with coining precision medicine. I think what is pragmatic is more personalized healthcare, right? Where population health management comes in. I wrote this piece called Precision Medicine Population Health. If you really apply it, if you understand a person's genomic profile at childbirth, understand their parents' genetic profile, you compile all of that data, you can actually predict whether there's a proclivity for cancer or cystic fibrosis, which is the beginning of population health management across the lifetime of the patient versus when they are in an emergency room. And I think, to your point, we are starting to get there with all of the data being captured in electronic health records, the ability to slice and dice them in sophisticated ways with artificial intelligence, going from descriptive, predictive to prescriptive analytics, understanding what the care gaps are, prescribe what are the potential actions needed to close those care gaps. We start to get close to what I think called personalized healthcare, which I think is pragmatic versus designing formulations for patients of one, which was a grandiose vision, but we saw very small pockets of that, like Herceptin, right, for women with breast cancer avoiding chemotherapy because they had the genomic markers to be diagnosed early and as a candidate for Herceptin. But I think personalized healthcare is where we are coming close to the proliferation of agentic AI or AI agents, which can automate workflows, drive prescriptive insights. I'm very fortunate to be working for a company at the forefront of doing some of that. It's really interesting to see personalized healthcare feasible in our lifetimes.
Well, and I really get to talk to someone who's sat in so many different chairs in healthcare. So maybe we step back from it and correct me if I'm wrong. Public health, I look at public health as more of the defense industry of healthcare, right? We're looking to address entire populations, communities at large. Vaccines comes to mind. And then we have population health that focuses on specific groups and communities with certain characteristics. And you were earlier talking about this concept of personalized medicine, which is actually the drug people saying, how do I make a drug for a person?
Yeah.
And now we have diagnostics that help us with this stratification. I think of it as like a dog bone. We were starting on the left with the concept of personalized medicine, but at the end of the day, that's an acute focus. And public health and population health is surveillance, monitoring, and anticipation of predictability.
Preventive focus. How do I prevent adverse events from happening by proactive action, proactive surveillance, analytics, and responsiveness?
And now that AI is coming to the drug manufacturers in terms of discovery, there could be some efficiencies that make that vision a little more practical.
Yeah. I actually refer to that as the Viagra effect. Viagra started out as a medicine for blood pressure, which failed. And then going back, looking at the data, it uncovered this interesting new application. And of course, lo and behold, Viagra was born. So I think there are a lot of Viagras hidden in those failed clinical trials. I think AI is a potent tool to go back and uncover those new indications, which could potentially bring drugs on which billions of dollars have been invested and turn them into potent therapies for orphan diseases, for instance.
So how did you get here? How did you start your career and how did you get on this path? It sounds like there's a lot of heads up opportunity taking along the way, but how did you prepare yourself to launch your career? What were your original objectives?
Very interesting. So I started my career in India following my bachelor's degree in mechanical engineering. I worked in my dad's company that made diamond saw blades. And then he came to a point where he said, my way or the highway. I said, thank you. I'm going to take the highway, and found my way via, I have the distinction of having earned 3 master's degrees in engineering and business on scholarships from 3 countries. So I went to school in the US, Israel, and Canada. I started my enterprise software career as a strategy consultant working for a company called I2 Technologies, which pioneered supply chain management, and then lost my mother at the untimely age of 58 to a massive stroke. And that led to some deep soul searching and introspection in terms of, what do I do? Is life all about earning a paycheck every 2 weeks, or should it have meaning? That soul searching led me to actually refuse a promotion. I was working for SAP and make a lateral move into running strategy and marketing for life sciences and then healthcare. the realization that I need to work for a company that is serious or already in the healthcare business, and which led me to G Healthcare and had me launching their cardiovascular IT and imaging platform. And then, obviously realized that with the Affordable Care Act, healthcare providers were really laggards in terms of analytics and AI. I think working for Tableau provided us with exactly that opportunity. How do you bring analytical insights to guide better care, superior outcomes, lower cost, and better asset utilization? That was the beginning of this foray into analytics, then AI, from a healthcare and life sciences perspective.
And so that's a very atypical marketing background for chief marketing officer.
Yes and no. In my humble experience, if I look around, you literally have marketers or chief marketing officer. Unlike product management is a well-established function, sales is a well-established function. Marketing is very diverse. You have chief marketing officers who come from PR Marcom background. You have chief marketing officers who come from a demand gen background. And then you have folks like me who have been product managers turned into product marketers, who tend to be more strategic, who tend to have more industry and industry trends, who understand solutions and technology really well. So I think it was an obvious evolution, right? An engineer looking at the big picture thanks to the MBA understanding of industry trends and saying, oh my God, it's so much more fun working customers, translating that strategic depth and vision into innovation. Working with colleagues in product management, they respect me because I've been one of them as a product manager and a product strategist. There are plenty of people doing that. In fact, I'd say some of the most successful product marketers or some of the most successful CMOs who are intrinsically very data-driven and analytical, right, who are constantly scanning the horizon, who understand industry trends, translate that into strategic innovation opportunity, and then work with product management to turn that into a new solution with realizable incremental revenues for their employers.
It's interesting because in the time that we started talking to today, you have a new job.
Yes.
As I listen to you, and I'll let you share it in a second with the audience, but it's in the population health segment. What strikes me is that today's marketing is all about digital segmentation and understanding what's going on with your customer. Population health, ironically, is segregation and understanding the status of the patient and what you can do to intervene. How did you take on this new assignment? What were you thinking and how did you arrive here?
My previous company, Tableau, where I was GM of the healthcare business, the very first population health dashboards or analytic solutions built by thought leaders like Mayo Clinic, the Cleveland Clinic, MD Anderson, Mount Sinai, Humana, Cigna United Healthcare were built on Tableau. So I almost had a unique vantage point to paint this strategic vision of the fact that you're going to really see analytics drive population health management, value-based care, reimbursement, population risk stratification, care management, because it was happening in real time in front of my eyes. Lightbeam Health was one of my customers with Epic and Cerner, who adopted Tableau as their front-end visual analytics solution or platform. So it almost feels like homecoming because that vision which I painted at Tableau in terms of analytics and AI driving this population risk stratification, care coordination, care orchestration is something that Lightbeam is doing with incredible depth, domain expertise, precision, and sophistication. I feel extremely rewarded and gratified that I'm now working at Lightbeam Health, which was one of my customers at Tableau.
Well, it strikes me that if we took a 20-year view of the pharmaceutical industry, everything was invented inside, right? You didn't share the data, you worked with more than a few entities, that you were giving up your intellectual property or unfair advantage. And it strikes me that somewhat the same story on population health, that integrated delivery networks and large systems kept their data inside. By being part of a bigger organization focused on population health in general, there's more data, more insights, right? It just seems to me that there's an evolution in this category. Tell me the history of population health as a software in healthcare in general.
I think fundamentally the recognition that unless you have transparency to that data, unless you can slice and dice the data and run analytics on it, you will always see Medicare, Medicaid, undocumented immigrants leverage the ER, their treatment of choice, which is extremely expensive and unsustainable. The Affordable Care Act brought some of that realization of the fact that we have all of this data which is being captured. Thanks to the Affordable Care Act, it went from paper-based in that manila folder in the doctor's office to electronic format. And now, if you have access to the data, the possibilities are endless, right? In terms of understanding, slicing the data, understanding risk at a patient level, understanding risk at an attributed population level, and then designing care protocols from a population perspective as well as a patient perspective, which allows you to deliver superior outcomes at a lower cost while ensuring optimal asset utilization within the context of a hospital. The ER is the most expensive asset in a hospital. It is also the highest revenue generating. So why would you want that to become a bottleneck and clog that up, which increases your risks exponentially, given that healthcare providers really run at 2% net margins? So
Anything we need to do, to your point, there's a new Netflix series called Pit, and it's an emergency room. I'm enjoying watching it, so I would recommend it for people. But it's people waiting like 4 or 5 hours to get in. You don't necessarily see that when you're living in a suburb, but you move into the big cities and you actually see how horrendous and inefficient this is. The concept of population health. About a year and a half ago, I was talking to a company that is doing drug discovery. And since you're an engineer, you can help translate what I'm about to say into something that's probably more truthful and easier to understand. When I ran an engineering group years ago and couldn't afford to run all the experiments, you would do this design of experiments, which was a philosophy that said, if I test the matrix this way, I can get a lot of information that I wouldn't normally get if I took traditional testing. And what is striking to me as I was talking to this person is every clinical piece of information they get, they're using predictive and AI to go back and say, now if we reran this experiment high data set, what would we know that's more truthful? Or what would we also, as importantly, things we thought were truthful that now would fail? And it strikes me as I'm listening to you, that's not a terribly dissimilar thing that can happen in a population health situation in terms of predictability.
Yes.
Data sets across ethnicities, across regions, gives you more insight into these kinds of pieces of information.
Exactly. It's not just predictive, but prescriptive insights, right? In terms of here are 4 care gaps that you need to close. And we have an award-winning remote patient monitoring solution, which allows care coordinators who are almost always understaffed to reach out via call and text to seniors or chronically ill patients, understand how they are doing, and proactively identify potential adverse event well before it happens and ensure that those patients are appropriately taken care of. So I think what AI has done is literally move the needle from descriptive analytics, which is rear view mirror analytics, to predictive analytics, to really prescriptive analytics. Once you take that to its logical culmination with agentic AI, now those prescriptive actions could become autonomous someday. So it becomes black box. Of course, you've got to be very careful when you're using that in a life and death patient situation. You probably see much more of that happening first in industries like retail, logistics and communications, in manufacturing, before you see the lights out kind of autonomous AI in a healthcare context. But I think that's where the world is pretty much moving to.
Yeah, I think we're going to see it on the system side. And I know you have a medical device background, so you know this to be true. The sort of AI robotics activities in hospitals right now are what I would call closed systems, meaning they're not linking out to the world and interpreting. They're very structured in their nature and have a lot of data to go through. So I think we're going to be on the administrative side first. And even with prediction, the ability to predict is very different from the ability to diagnose.
It's interesting that they should say that. I actually wrote an extensive blog post on medical robotics, which people don't traditionally think of within the AI context. But AI in medical robotics, coupled with machine vision, virtual reality, and of course AI, driving it is doing amazing things. There's far more adoption across Asia. In Glad Hospital in Thailand, you've got nurse robots dressed in nurse uniforms who deliver medicine from one patient to another and can converse in 4 languages. Wow. You've got companion robots in Japan who provide companionship to the elderly, help them clean and bathe, dress their wounds, and serve them medicines. You've got exoskeletons which help veterans of war from Iraq who have lost their limbs regain their gait and their locomotion. I think the best known example is the robotic surgery from companies like Da Vinci, which allows a physician, either in close proximity or across the continent, to move those robotic arms and perform surgeries which assure the fastest recovery times for patients. So I think all those artificial separation, we're going to see that blur, and especially as agentic AI. So agentic AI is nothing but robotics in software format. Imagine the hardware and software coming together. Those robots are going to become far more sophisticated. Processes that require manual intervention today are increasingly going to be totally automated.
And I think that to your point, where the Da Vinci really broke through is in prostate microsurgery. The other aspect is the ability to cauterize to something physical at the micro level that a human hand just can't possibly do.
Absolutely.
That device keeps the wisdom of the physician with the dexterity of being able to do micro moves that
Indeed. Indeed.
When you look, you obviously just did a due diligence on the population health industry to select a company to go work for. What's the status of that industry and where's it evolved and where is it today as you see it?
I think it has evolved significantly from the time I was working with thought leaders like the Cleveland Clinic, the Mayo Clinic, and MD Anderson in building out dashboards. Today, you are seeing the advent of predictive analytics, prescriptive analytics, the use of machine learning, natural language processing, Gen AI, increasingly agentic AI, to be able to automate a lot of those processes, to be able to drive very actionable next steps through prescriptive analytics. The level of analysis is indeed mind-boggling. So I think we've come a long way. There are ways to go as we see more and more advances in agentic AI platforms. I just came back from HIMSS, which is the largest healthcare IT conference. And the theme du jour, no surprises, was it went from Gen AI last year, where ambient listening already appears to be commoditized with multiple vendors presenting it. I got into some interesting conversations saying, you're betting a feature on this application, which will become a feature in an electronic health record that is likely going to be rebuilt from the ground up. We have a huge advantage over them. The pace of change has been accelerated given the advent of AI. Seeing which processes, to your point, some of the administrative processes, sales, marketing, customer service, manufacturing, supply chain, revenue cycle management, strategic planning. I think those are obvious candidates. Then what level of automation do we accomplish with significant clinical intervention in a clinical context, in the value-based care context, within surgeries, interventions, etc.? I think it's going to be a magical landscape, right? That's going to undulate in front of our eyes with folks like you and me as observers, which is going to make life very fascinating indeed.
Well, and I think too that we can add a little controversy to this conversation because you had talked about how the big EHR people are seeing these eventually as features. A boy from Boston who grew up when Wang word processors were there, right? And they were cranking it up and the computer people came to Wang and said, you really should buy us. And he said, I'm making lots of money doing this. I don't see any change. And the next thing you know, whoops, it's gone. It comes down to is the way you look at the world. And the electronic health record industry is very different from the statistician predictive AI industry. There's different skill sets. And so it is certainly possible they can evolutionize their way up, but it's also equally plausible that the AI company sees it as a commodity. The ex-Google CEO was part of the committee in the government, and it was all about what access can AI APIs have into my software. So having an API into my software to exchange data is one thing. Having an AI coming in and doing other things and learning from that is an intellectual property violation that's not really been scripted in our laws yet.
The reason why Gen AI, despite the billions of dollars in investment, the FOMO-driven adoption has seen very little innovation, right?
Yeah.
But because of the hallucination, IP infringement, all of those issues, which is why my prediction, I just wrote this post in terms of agentic AI is going to subsume Gen AI. So Gen AI is actually going to play a supporting secondary role, either as small language models, curated small language models, supporting an agentic workflow. Right, the database is in the SLM, but all of the orchestration from input to output is done by the agentic AI workflow. That's an absolute, I think there's room for special. What's very interesting is, I think it's going to be a three-phase evolution in terms of enterprise software. The first is the move from machine learning, natural language processing to Gen AI, to agentic AI, and of course, robotics looming in the background. What I saw at HIMSS was very interesting, the advent of AI platform as a service platforms that a healthcare system or vendors like us could potentially embrace and use to create our own apps or workflows. So there's a little bit of who'll win and how will that evolve. I think phase 3 is the entire enterprise SaaS applications on AI platforms. In the healthcare context, one has to exercise caution, right? Interoperability around FHIR and TEFCA, all things that need to be baked in a very robust way into those platforms so that patients' lives are concerned, clinicians and nurses can trust the outputs versus something being black box and not knowing whether the data is accurate. Healthcare will take a slightly longer time, but it'll still be faster than the pace of evolution we've witnessed in the last 2 or 3 decades.
I think the most obvious use for AI at the beginning for physicians is bringing variance to them, meaning that I've worked with a precision medicine company that was focused on pancreatitis, right? And I'm making this up to be extreme, but you and I both go see the same doctor and I have a certain rash, and for you, it's slap some cream on it. And for me, I'm on a pathway that we can intervene in. How would a normal physician who's seeing 50 to 100 patients a day be able to pick up on that very quickly? This is the value of that. If we do it right, we actually allow the physician to have more fun and more judgment and more conversation. I think about the Star Trek Training Academy. The students were learning by interacting with the AI. Right?
Yeah.
They were having this sort of a Socrates kind of Plato experience with the philosopher. And so I think that's potentially the way we can go.
Or spend more quality time with patients, which they love and which is what that profession is about, versus entering data into an EMR. I think ambient listening exactly addresses that, right? The physician notes are automatically captured. You look at it in your smartphone, you lightly edit it, and then one press of a button or a voice command, and it's entered into your patient notes in your EHR. I admire Dr. John Halamka, who's the head of the Mayo Clinic platform. One of his quotes that I've heard really resonates with me, which is that AI is not going to replace doctors anytime soon, but you'll definitely see doctors who deploy AI for assistance and for efficiency and replace those that do not embrace AI.
And it makes sense, right? Because why do you go to Mayo Clinic or Cleveland Clinic? Because when you think of a normal distribution, it's the tails that have the crazy stuff in it. Right? Statistically, if I'm in Methuen, Massachusetts, I'm not going to see those tails. But at Cleveland Clinic, Mayo Clinic, I'm going to see those tails. And that's why those doctors coalesce there. And this allows us to really disperse that information eventually out into the rural areas and things like that.
Absolutely.
How do you keep current on all of this? What's your process? How many hours a day do you read? How do you keep this stuff organized in your head?
Yeah, it's very interesting. So I kind of leverage and harness the power of technology as much as I can. Journals like HIMSS, Becker's Hospital Review, MedCity News, all put out very compelling content, usually enriched by real-world case studies, which I love. Having just programming business rules that bring that into my inbox is one way. I'm extremely interested in AI, which is also relevant for my job. So I proactively go out and research what companies are doing. And then literally, as I've said before, I have a little bit of a gift of looking at what everyone else has looked at and seeing what no one else has seen, projecting that out. I just came back from HIMSS. I saw these multiple ambient listening platforms. I saw this robotic AI virtual nurse. I saw this agentic AI platform as a service. How do you make sense of all that? So I like to project, I like to predict, I like to prognostize, right? Play the visionary a little bit. Happily for me, I've tended to be right 90% of the time. For instance, recent example, you saw this, you talk to people, talk to 10 people what AI is. And for most of them, for 8 of them, it's Gen AI and LLMs. And that is so incorrect. So I wrote this piece on, we should really look at AI as a portfolio management approach to AI, no different from the portfolio management approach you have in any healthcare system where you are managing your electronic, medical record, you're managing your nursing systems, you're managing Press Ganey, you're managing almost 100 platforms, right? Adopting that same AI approach and increasingly hybrid, right? It's never just one form. In fact, we're already looking at the evolutions of multi-agent, machine learning, natural language processing, Gen AI, agentic AI working together to deliver value and ROI for the use case in question. How do we enable and empower clinicians? How do we empower nurses there's a huge shortage to address this overarching strategic problem of physician and nurse fatigue, bringing productivity, taking out errors from repetitive manual processes. And if you're focused on that end goal versus, hey, AI is this new bag of tricks, this shiny new toy that we've got to deploy, I think you'll end up with very different results and value. And that's what I write about. So that's a big driver. Just investing the time, doing that research proactively, drinking in from all of this wisdom that's written, engage with companies that are doing innovative things, engage with early adopter healthcare organizations, which are actually deploying AI and seeing some, for instance, Johns Hopkins, right? Johns Hopkins, Dr. Suchi Saria, who also founded a company called Bayesian Health, has created a machine learning application for predicting sepsis in the ER and in the ORs. And that is literally saving lives. So applications like that spark my interest. By the time you read something, it's probably already outdated because release 4.5 of OpenAI has just hit the market, which is your best. Have a forward-looking perspective in terms of how do you make sense? How do you connect the dots? What does it mean for observers and visionaries like you and I? What does it mean from the standpoint of me, the empowered patient? How is this going to impact care for me and my family? How is it going to impact the lives of physicians and nurses that we just talked about? Then draw a thread through all of that, and then it starts to make sense and result in a narrative and a story that hopefully is valuable for our audiences.
Do you have a particular AI resource that you go to consistently? Are certain people you follow on LinkedIn or certain YouTube people you follow?
Yeah. So I'm very fortunate. I follow visionaries and thought leaders like Dr. John Halamka, right? People like him who are paving the path. On the other hand, I have a former colleague from Tableau who has given up on full-time employment and now is a strategy consultant for companies seeking to deploy AI applications. He's got a newsletter every Monday, which talks about the latest use case he's deployed. With Gen AI, he's working with agent.ai, which has come from HubSpot. You're constantly learning about new apps or deep research from OpenAI. For that $200 per month, here is all the value I'm seeing. But those two very disparate.
So give up the name, my friend. Who is this?
This gentleman's a very good friend of mine. His name is Vikram Ekambaram. I'll send it to you, sir.
I'll put it in the notes.
Yes. And he writes this newsletter every Monday morning, very diligently. You see a new set of insights and very practical. This is stuff you and I can do. He, like us, has a business background in sales enablement, in solution engineering, and just using prompt engineering. He's doing amazing stuff, solving problems. Companies, small to large, are engaging him to build out applications which would cost far more if they had to hire large consultants to do it. Very interesting. So you get those two diverse viewpoints and make sense out of that, connect the threads and move on.
What's the biggest lesson you've learned thus far in your career?
Very interesting. I think the biggest, personally for me, I'm genetically wired to be purpose and passion driven. I think the Japanese have a beautiful word called iki, the French call raison d'etre, your reason to be. Ikigai is, what are you passionate about? How can you make money from that passion? How does it do good to society? And it's something that you find fulfillment in. Thanks to the story I just told you, the untimely loss of my mother, I found my ikigai, my true north, my higher purpose early on. And I've stayed with it. I've enriched from the time when someone told me, oh my God, you're an immigrant from another country. What do you know about the US healthcare system? Writing that blog on personalized medicine, which was adopted by Harvard Medical School. So I think just giving voice, finding your passion, being hungry, in the words of Steve Jobs, stay hungry, stay foolish, be a perpetual learner, and constantly keep learning with an open mind, I think is the secret to thriving and succeeding in this very rapidly changing world.
So how many hours a day do you commit to this kind of learning?
It is very, I'd say, from an hour to 2 hours every day.
That seems to be, as I ask this question to everybody that I speak to, it seems to be a pretty significant commitment that people make. And we've all, or maybe don't have young children anymore. When the kids were young, it's very hard to keep that up. But you get up at 5 a.m. and you do it that way, or you do it late at night.
I'm a late night person, so that's when I do my stuff. I've taken courses with MIT and Harvard, which is usually, again, part-time. So you would put in a full day's work, put my wife and daughter to bed, and then that's when I'm starting on writing my blog post. It's got to be passion driven. It's got to be for personal enrichment and growth and aligned with that higher purpose. I think that's when the magic happens.
So as you look at healthcare over the next decade, what do you see as the biggest opportunity and threat in the broader system?
That's a very interesting question. There's clear opportunity in terms of workflow automation processes, analytics, prescriptive insights, driving better outcomes. I'm also coming from the country I do, which has the world's most advanced system of naturopathy. I think alternative healing as a therapy, I've seen that at work in India, is amazing and has a lot of potential. So again, by definition, it is healing that was prescribed in the Hindu scriptures, now brought to life with healthcare-like protocols and manufacturing. Do they start to adopt technologies like AI, which is a little bit of a antithesis, if you will, and not entirely intuitive? How do those two worlds coexist? And then one of the things that most people don't talk about are the malevolent uses of AI, right? All of this vision that we're painting could completely go haywire if you start to see AI from fake news to terrorist activity enabled by AI or ransomware in a healthcare context by virtue of access to the data, right? There are some very formidable, unfortunate things that could potentially happen. So I think that's the landscape, that's the canvas. Does the good, does the benevolent, the benign uses of AI triumph over the potentially malfeasance or the malevolent uses of AI? I think that will determine the course and how much we see adoption.
You could have 1,000 wonderful things and one bad one that could impact 1,000.
Exactly.
That's the scary part.
Exactly.
Yeah.
Exactly.
But it's unfortunately or fortunately, my dean at CMU will always talk about the technology as the head of regulation and law, and they always reconcile, but it's generally an adverse event that causes that.
Exactly. So I'm very pragmatic, as I'm obviously enthusiastic. I call myself an AI technology visionary. So it's my job to look at how is it doing good? How is our patients being impacted? How is physician and nursing productivity being impacted? But at the same time, you have to keep your eyes open for what is going wrong or what could potentially go wrong that would become an inhibitor to this accelerated adoption for the greater good.
What else would you like to share with the audience?
I think be positive. Times of great change, they cause a lot of trepidation. I think I'm cautiously optimistic, but I think being prepared, adopting, embracing change, which doesn't come easily to most people, is probably being open-minded, learning, keeping your eyes open, being the perpetual learner and embracing change is probably the only way we'll succeed in this very kind of tumultuous times ahead of us.
And I think that's sage advice, particularly at this juncture. There's plenty of opportunity for those that want to change. I'm reading various books on adoption of technology, and the speed at which this change is happening has never been seen before. So you could be 45 or 50 years old and say, is it going to hit me in my career before I retire? I think the answer is yes. And and you need to think your way through it.
I'll give an example as an anecdote to conclude this conversation. So I've gained the day when marketing is all done by AI. And I'm overseeing a plethora of agents, right? Which is the extreme scenario. What do I do then? It will tend to be redundant. So I'm training to be a hypnotherapist and a life coach.
I'm a certified hypnotherapist.
That's amazing.
Yeah, we'll talk about that offline.
Yeah, that is amazing. So I'm actually learning to be a hypnotherapist. I'm learning from Paul McKenna, who's pretty amazing. I'm prepared for that eventuality, right? How I can reposition myself. Something like hypnotherapy is obviously the core hypnotherapy skills, and it's obviously a lot of marketing, building your audience, your brand, and getting the right segmentation and targeting. I think I'm reasonably well prepared. It's that forward thinking, being prepared for change. I think that'll separate the winners from the losers, unfortunately, or just people who are not prepared.
Hypnotherapy is about your beliefs and values, and your subconscious wants to protect you, even when
exactly
good things.
Exactly.
And so what you're trying to do basically is to reconcile the protective behavior that might not be serving you well. As I think about AI in marketing, getting these data points is very similar. So I get philosophically why you're going in that direction. That's very intriguing.
It was really the universe telling me, right?
Yeah.
I've been working on manifestation. I had a guru for 15 years. So now I'm moving back to quantum physics with Dr. Joe Dispenza. I'm actually on my way to one of his retreats.
His work's amazing.
So it's a universe telling me that this perhaps is an eventuality or a potential path that you should explore. And I think just learning self-hypnosis and all of that has really changed my trajectory. It's made me extremely positive. I'm working wonders in my life. So it's pretty amazing.
Congratulations. Thank you for being with us. I really appreciate it.
Thank you, Jim. Really enjoyed the conversation and looking forward to the final product and many more opportunities to collaborate and partner with you.
Thank you. Thanks for tuning in to the Chalk Talk Gym podcast. For resources, show notes, and ways to get in touch, visit us at chalktalkgym.com.
This podcast is produced by Outcomes Rocket, your healthcare exclusive digital marketing agency. Outcomes Rocket exists to help healthcare organizations like yours to maximize their impact and accelerate growth. Visit outcomesrocket.com or text us at 312-224-9945.